I am so happy and delighted to be with you in this webinar. My great thanks to Dr. Murtada Kurdi for their efforts in arranging of this conference. I know it was a great job from their side to arrange for this conference. Hopefully we can present new things to assist our doctors and students in their medical works. My appreciation to all international and national speakers who participate with us now in this virtual conference, and also to our professor, doctors, and dear students who present in this webinar. Now I will ask Dr. Murtada to start this webinar, and thank you to all.
Thanks, Dr. Mazen. Welcome, everyone. My name is Murtada Mohammed Kurdi Jalal. I am a clinical educator from Edinburgh. May I introduce my colleagues, the speakers in the webinar and the discussion panel. Dr. Susie Roy, Clinical Teaching Fellow at Edinburgh Medical College, and a clinical educator at the South East of Scotland Clinical Educator Program. Dr. Andrea Rosanese, Senior Lecturer of Medicine from Negrar, Verona, Italy, and a clinical educator at the Royal College of Physicians of Glasgow. Dr. Mohammed Al-Akaba, Assistant Professor at the University of Nottingham, Ophthalmology and Division of Neurosciences, Queen's Medical Center in Nottingham, England. Dr. Sonia Barres, Clinical Teaching Fellow at Edinburgh Medical School and Clinical Educator at the Royal College of Physicians. Dr. Mohammed Al-Hijaji, Lecturer of Surgery at Al-Zahra Medical College, Clinical Educator at the Royal College of Surgeons of Glasgow. And the discussion panel, Dr. Jawad Al-Kharasani, Vice Dean of Scientific Affairs at Al-Zahra Medical College, Assistant Professor of Surgery at the University of Basra, Iraq, and Dr. Catherine Robertson, Clinical Educator from Edinburgh, practiced clinical teacher and general practitioner at the Southeast of Scotland. Dr. Hussein Abdul Sada, Head of Microbiology Department at Al-Zahra Medical College, Basra, Iraq, and Doctor of Philosophy from the University of Leeds, England, United Kingdom. I am also pleased to introduce Mr. Hashim Al-Hayat. He is the Clinical Director of Arab Boards of Health Specializations in Basra, and also he is the Head of Training Board of Surgery in Basra. Mr. Al-Hayat completed his surgical training in the Royal College of Surgeons of Edinburgh and was qualified in 1981. And since then, he was practiced as a consultant general surgeon in Iraq and led the surgical department during war times. So Mr. Hashim have joined us in our webinar today. We would like also to welcome our attendees and audience from everywhere, and thanks for being with us today. I shall start my presentation. Okay. So welcome everyone. My name is Murtada Mohammed, and the weather is nice today in Edinburgh. Temperature is 15 degrees. And here is where I work. This is the University of Edinburgh. This is the main building. And you can see that this part of the building here is located in the big map here. Well, the big part here is the hospital, which is the Royal Infirmary of Edinburgh, and it is a tertiary hospital. So just a brief background of myself. So I teach undergraduate medical students at the University of Edinburgh in collaboration with the Clinical Educator Program. And I train postgraduate medical doctors at the Royal College of Physicians and Surgeons of Glasgow and affiliated to the Clinical Educator Program, and I work for the NHS of Scotland. I'm going to talk briefly about my topic today so as to allow sufficient time to my colleagues. So I'm going to talk about the development of educators. So the learning objectives, by the end of this session, you will be able to understand the concepts of how to develop clinical educators, outline strategies of educational development, apply a scientific technique depending on evidence-based practice, reflect on yourself, and evaluate your teaching. So, one of the essential characters in the process of learning is the teacher. So what makes the best teacher? Actually, that is a hard question to answer. And in the literature, there are a lot of definitions and criteria. But what I found is that in 1996, Kruger and Denisi state we are more likely to increase effort when the intended goal is clear, when the high commitment is secured for it, and when belief in eventual success is high. So here's the hierarchies of learning. The levels of thinking skills is usually systematic, starting from low order thinking skills like remembering, understanding, and going upward through applying, analyzing, evaluating, and until reached to the level of creating. So in order for someone to be creative, it's expected that he should have passed all these steps. And this is a vital subject in our learning environment nowadays, because we are facing a range of students who are with various needs and different levels of attitude. So the aim is to increase the awareness of different conditions that come under this umbrella. And a successful educator should be able to weigh his or her learners' abilities, and most importantly, know how to support them, such as making the teaching materials accessible for revision, like creation of a shared drive online. Learning styles as clinical educators, understanding different learning styles allow us to adapt the learning experience to the specific needs of learners to enhance learning environment. So this is all about the learning and the target goals. So what I found is most useful in my own clinical practice is that Kolb's learning style is the best in terms of how to apply it in the clinical practice. So Kolb's learning style is theory of experiential learning. And in the next slide, I'm going to show a diagram which shows that the Kolb's experiential learning cycle is composed of 4 stages. And it is expected that for everyone's experience is under observation and reflection. And by this, new ideas come and develop, and these ideas are under testing in practice, and then the cycle repeats itself in a vicious cycle. And in the next slide, I'm going to focus on this stage here and to explain what is meant by reflection. So what is reflection? Self-reflection, it is a process of continuous development through a cyclical self-feedback. For example, everyone who would like to teach, it's expected that he self-assess himself, then consider facts, and then practice, and then as keep on going. As effective educator should determine student needs. Ideally, evidence-based learning style should be adopted. And self-reflection and development are the keys for a successful learning. Thanks for your attention. I'm happy for any questions.
Thank you,
I hand over to my colleague, Dr. Susie Roy. Susie, are you able? I'm going to stop sharing, and if you are able, please to share your screen.
Underlying emotional dysregulation in the care provider. So things along this line would be things such as depression or anxiety. So I'm really focused on this clinical situation channel. So when the patient generates an emotion in us and that affects our decision making. And fairly recently it's been shown as what this paper addresses is that disruptive patient behaviours do alter our diagnosis, and often in a detrimental fashion. You can pop it in the chat, or and I will endeavour to answer them. Otherwise, feel free to email me, or you can tweet me. That's my Twitter handle at the bottom. Thank you.
Thank you, Susie. That's really impressive, actually. So shall I move to my colleague, Dr. Andrea Rosanese, and an interesting topic about hands-on teaching experience from Italy. The discussion panel and our colleagues, shall I, Dr. Mohammed, if you are, yes, you are exit the share screen. So shall we move to the discussion panel? And I'll hand over to you. Any questions, Dr. Catherine Robertson, Dr. Jawad Al-Kharasani, and Dr. Hussein Abdul Sada?
I have a question, if you don't mind, Dr.
Yes, sure, Dr. Mohammed. Yeah.
I have a question to Dr. Roy. Thanks for the presentation. It's an interesting field, actually, what you're studying. Do you have any experience of the emotional impact of COVID-19 on medical education?
Dr. Suzy, yeah, I knew
it. Thanks very much for your question. You've moved on the screen. I mean, that's not something I personally have considered. I know within the field of emergency medicine, there's currently a longitudinal study which is examining just that, the emotional impact of COVID-19. I think there's two different ways in which you can kind of consider emotion, either the output of kind of clinical practice, and I guess in that sort of vein, I'm thinking about things such as grief and stress and the almost effects of working in medicine. I think the thing that I'm probably more interested in is how these impact on our clinical decisions. So I think I've kind of dodged that question, but I don't have anything kind of more concrete to answer with, I'm afraid.
It would be a nice chapter in your PhD if you manage to get some.
Absolutely.
Okay, so any other questions? The discussion panel, Dr. Catherine Robertson, any questions? Dr. Jawad Al-Kharasani? Dr. Hussein Abdul Sada? Okay, we have actually in the Q&A box, we have some questions. I can answer one of them from Professor Nouri Abdul Nabi Nasser. He asked, to what extent is coronavirus pandemic impacting modes of teaching and learning in higher education? Well, actually, this is what all the educational institutes here in the UK and all Europe is moving away from face-to-face contact. So we are mainly relying on online learning modes, and they have a lot of actually tools to do this. And one of these is the webinars. So they are moving away into a new learning style. I hope this is answering your question, Prof. Nouri.
Actually, I could give another example. You know, for part 2, the final part for ophthalmology training exam, you know, to release the last batch before they becoming a consultant. The trainees have already applied for the final exam before this COVID situation. So the exam got cancelled. So what the Royal College are planning now, I mean, they have to have their final exam. So they set sort of a new theme for the exam. So initially, all the trainees, they got an email asking them to get in touch with a specific consultant in a specific NHS trust to go and have their examination skills assessed. That's the first step before the final exam. Once they have this sorted, then probably, and that is the plan, for them to have the final exam using a virtual way. So you will be presented with pictures, different scenarios, and you will be assessed based on that. But that is sort of, it's a pilot of...
Nobody hear me?
Murtada?
Dr. Mohammed, yes. Okay, thanks Dr. Mohammed Al-Akaba for the nice talk.
So next question, I think it is about my lecture by, I mean in the Q&A, Ali Mu'in. So he asked questions about learning objectives. So doctor, you mean that every session needs learning objectives, and these learning objectives should cover the whole information about the session. So learning objectives are important things so for students to know prior to start the session, because the aim of learning objectives is to highlight important points about the student that they don't know, and at the end of the session, so they need to know these things. So, I mean, students will be able to do at the end of the session that they cannot do at the beginning. So, learning objectives should cover at least the middle of any lecture, seminar, or sessions. I mean, the whole informations in the session. Hope that answer is fine.
Thanks, Dr. Mohammed. That's really impressive. So we have another question from Dr. Mohammed Salman Al-Maliki. He asked, how do you see the future of online learning in compare with the traditional classroom learning? Actually, this is the hallmark of the current situation. So it is all moving toward online teaching. So this seems to be the future of teaching. I hope I have answered your query. So is there anything else you would like to mention, the panelists or the attendees, our audience? Is there any question you can pop it on the Q&A box?
Well, I think the other thing that's quite interesting about online learning is that there's quite a lot of concern about the ability for us to build communities online, which is supposedly said to be easier in kind of face-to-face environments. But I think actually moving to online learning represents a kind of good opportunity to manage the more negative aspects of things like the hidden curriculum of biases. So I think, and I think in well-constructed courses that hopefully we'll be able to kind of build communities. And I think things like these synchronized sessions that you've organised kind of are a step in the right direction.
Cheers. Thanks, Susie.
Yeah. May I add just a quick note?
Yes.
Murtada.
Yes.
I think that even if virtual online teaching and learning, of course, is going to gain much more space, in medicine, it cannot completely substitute the hands-on and the in-presence teaching and learning, because there are some aspects of teaching medicine that cannot be passed through a PC monitor. And there is something that deals with the real life problem solving, trying to put the hands and to do something in practice that cannot be taught and that cannot be evaluated. And this is another part of Dr. Mohammed Salman Al-Maliki second question, to evaluate students' achievements. Of course, if you think that evaluation of achievements is only a question of assessing notions, I mean, things that you have got into your brain, you can do that through a quiz, sort of a trivia quiz, before and after. You didn't know, now you know. But when it comes to something that you should demonstrate that you have learned to do, it's much more difficult to transfer to virtual. And that's why I think, and probably I hope for what I'm, the way I'm done, that it never stops to have a direct and living confrontation with students.
The value of simulators as well is really important, especially during the COVID time. So many departments, if it is feasible to use simulator instead of patient for bedside examination, that would be kind of a safe approach, and at the same time you will have a hand-on practice. Yeah, that's one of the things to consider in addition to the online learning using simulators.
Thanks, Dr. Mohammed and Dr. Andrea. So, is there anyone in the panelists who would like to discuss or ask any questions?
Yes, if you allow me, Dr. Murtada.
Yes, sure, Dr.
Yes, I think the practical examination in medicine is crucial. And one of the important things when you are asking the students for a task, you need to feel that, not just sending him a video or demonstration, live demonstration. Actually, the most important things is in teaching online is we are losing the eye-to-eye contact and the body language and all the effectors that is not really after online learning started. We feel this is very important and crucial. Probably we do it subconsciously when we are teaching our students, but now we feel that this is very crucial and very important. That if you, whatever you do, there is a shortage, especially on a clinical examination. And the second point, even online theoretical sessions, again, you are not feeling the student. Probably you feel their sounds, they are tired or not happy or something. Actually, whatever we did in online teaching, we miss a lot of things that it is crucial for conducting our material. The sympathy, the feeling, the eye-to-eye contact, the body language, all these are things that cannot be cannot be replaced online teaching by online teaching. We hope that this situation is stopped soon or earlier in order to not expand this period, which definitely will affect our learning outcomes, especially on clinical training. Thank you.
Yes, Dr. Jawad, that's absolutely right. Is there any questions from panelists or Dr. Mohammed, would you like to see if we have any questions in the Q&A box, please? And if anyone is happy to.
No, I just want to add to, to Mr. Andrick, comments for Dr. Mohammed Salman Al-Maliki. So about using learning objectives, whether it's as specific targeted verb actions or pre and post quiz, statements. To be honest, both ways are true. However, using quiz in the learning objectives makes your targets a bit restricted in terms of understanding at the end of session where what we want your learners to learn at the end. So whilst in our presentations using discrete, clear verb of actions and the learning objectives make the target a bit broader and the understanding at the end. So pre and post, yes, it's true, but it usually keeps the understanding of learning lecture a bit limited to only these questions. And for this reason, using action clear verbs in the learning objectives makes meanings clearer.
Yeah, thanks, Dr.
My comment. So
thanks very much. So shall I move to the next question by Dr. Falah Hashim? He asked, what is the best feedback for my subject? Is it the learner agreement or the grades or the assessment or something else? So I would say everything counts. So all these factors are affecting. So grades give you a numerical assessment of your achievement, and the agreement give you a qualitative, yeah. So it is a matter of quantitative versus qualitative. So both of them are important. Is there anybody?
I do understand from Dr. Falah that he want to assess his subject when he is teaching the student. When he is teaching the student, he need to have a feedback about the subject.
I think if he is able to reply, he will. I mean, he can pop in another question, maybe if he would like to add any comments.
Just if this is the question, is what's about your feedback on when you are doing your job during learning? Just this is on a few points about our teaching style, as we are in the beginning of our college, just we have on a 3 years college, new college, that adapts the England, United Kingdom curriculum, which is integrated outcome-based curriculum. And we are struggle to face obstacles in sending message to the student. Our lectures or all the learning activity, all the learning opportunities. When we started, we have a couple of teachers and tutors visiting the lecture or stay with the student as a learner. And then we have a lot of feedbacks. In addition to the feedbacks from the student, we have feedbacks from the colleagues. And no lectures or no small group attended by few number of tutors. Almost all of us divided in all these stages. And we have, as Dr. Murtada said, the called reflections, the cycle of learning of adults. We repeat these things together and we learn from each other, but we make the message clear for the students more and more every time. Thank you.
Thanks, Dr. Jawad. That's very nice. And is there anyone who would like to answer any questions in the Q&A box?
I mean, the question from Raghda Sha'ban Tawfiq
Yes.
regarding e-learning quizzes, how can we reduce the risk of copy and paste technique through using a specific question formula? I mean, there are different ways to try and limit what we call cheating or risking of passing the answers among students. One of them is trying to set up a time. So you give the student a task, a specific time, opening time and closing time. So you give them very short time to answer, or a limited time to answer these questions. I mean, it has to be justifiable time, basically. But still, this is not the ideal. There isn't any ideal, but in our experience is replacing quizzes with a coursework, like an assignment. It's more mentally challenging things, and you have to spend time and you have to spend efforts, and it cannot easily be passed on between students. There are other invasive ways, which is setting up a webcam during the examination, or when you set up an online exam. But this is it needs a lot of basically resources. So there isn't any a clear 100% answer to this question, basically.
Yeah, it makes sense. Sure. Thanks, Dr. Mohammed. Yeah. Here we have some other questions I would like to answer, just to summarize up what we have been through. So Dr. Muhammad Salman Al-Maliki asks, what about the elective exchange model in education? So if you are talking about simulation, this is currently what is going in the medical colleges in the UK. So they are moving towards simulated scenarios, words, and such kind of education models. There is another question from Dr. Muhammad Hassan Aboud Mohsen to Dr. Muhammad Al-Aqaba. He is asking how to improve the outcomes of learning.
Well, this is a very broad question. It depends on which type of learning. So in my experience with the BMedSci projects, what I found is when I started at the University of Nottingham, and I had the first student to do the BMedSci project for 3 months, I assigned a specific question to be answered, and we set up like a lab experiment for the students to perform. My field was studying corneal innervation in health and disease and following corneal procedures. The difficulty for the students, he's coming to study a very specific field and asking specific question. The student didn't have any prior experience with this. So what I found in the subsequent students, like if you have a package where you start with the normal anatomy and pathophysiology of disease, and you give the student this package during the summer holiday and give them time to read it, when they come in September, they will be more ready and digested all the background knowledge to start working on the project. For the first student, we didn't do that. So she spent some time to study to go through the background when she started in September. So it all depends on the type of learning, basically. And that's one way is to improve things is having a feedback from previous students. And that's how we build on with our learning process.
Yeah, thanks, Dr. Mohammed. So shall we move to
Murtada, I want to ask some questions.
Yes, Dr. Mazen, yes.
Thank you. Is there any difficulties in e-learning from the side of students or teachers in Italy, Canada, or in UK about refusal to take lectures in e-learning or to prepare lectures?
So what's my idea is that they are unifying the e-learning in over all the countries. So they are adopting certain smart tools, including the Zoom, of course. And for example, the University of Edinburgh itself, it has a lot of smart tools for e-learning. For example, we have what is called the Learn, the Pebblebad, and such kind of tools which enable the students to engage more in e-learning. So people here are working on the software and trying to make the sessions interactive rather than only display mode of sessions. And that's how they make people engage into teaching online, as I think.
Because in Iraq, you have some difficulties with the students to engage them in e-learning. Because e-learning in Iraq, it is new things happen nowadays.
Yeah, I know. So the best way is that people here are also working on this important aspect. They are trying to make students entering an interactive session rather than a display-only session. So what this means is that during display of any lecture online, there are multiple, perhaps some sessions of quizzes or questions and answers as a break throughout the session, just to keep them engaged and attentive. So that they are working on this. They are trying to improve it, to develop it more, especially in these days with the corona pandemic.
Thank you. Thank you.
Thanks.
Dr. Murtada, if you have a time, please.
Yes, sure.
Just raising question.
Dr. Hussein, yes.
So thank you very much for all. They are very nice talk. But I want just to raise a question. So we all face this crisis for COVID-19. Do you think something will change in the teaching of medicine? I mean, do you think we need another subject for dealing with such crisis?
Yeah, that's actually a good question. So it depends actually on what is going on for the next future. If this is only, I mean, a single wave of pandemic, I think they are developing their online teaching. They are reducing the face-to-face contact as a precaution, but we don't know what is going to be in the future. But most likely, all the things are directed toward e-learning.
Sorry, I mean a teaching subject.
It's not just how to deal with the teaching.
Yeah, so you mean, if you mean by this the virology science?
No, I mean also the how to deal with the crisis. This is the important thing. The student don't.
Yeah, it seems to be a part of the infectious disease department in each university or each institute. So people who are working on virology and infectious disease, I think they are setting new strategies to deal with this situation and any other pandemics. They have good protocols to follow, and they are working on them. They are developing them, and hopefully they will reach a solution.
Yes, thank you very much.
Dr. Murtada,
yes,
about the assessment during examination, we know any student can send his answer to other student during electric examination.
Yes.
How you prevent that this fraud or cheating method in examination?
Yeah.
And I want to hear some opinion from your side.
Yeah, that's actually an important question. And what I can see here, the examination centers, what they do is that they bring students to their building, the institute. They do the social distancing. They put the chairs or any perhaps tables for the students, and they put the laptops on. So the students are able to do their online examination inside the institution itself, and considering the social distancing as the first precaution. So that is how do they prevent. So every student who enter to the examination, he enter to a room where with all the examination settings. So they limit any kind of fraud or any kind of perhaps cheating or some that kind of perhaps things.
Yes.
I think the other thing, if you have like sort of assignments for the students, like a written piece of work, we should actually emphasize the importance of detecting plagiarism, and we should have access to a software where you could actually check each submission against a pool of submissions to see if there are any duplicates, and it's very easy to do using computers. So that's a way also of detecting, copy and paste, especially if it is a piece of work of writing.
Thank you.
Thanks, Dr. Mohammed. And we have actually some questions here on the Q&A box. Dr. Huda Umran is asking, how can we recognize talented students and support them through e-learning? So I think, talented people are able to show their talency throughout different means. I mean, there is no limitation. So the real classroom, it is, of course, is a good opportunity for people to show their talency. But e-learning, I think, through their assignments, through their creativity, they are able to express this as part of the e-learning.
Add something to that, Jalal.
Yes, please.
I suppose I have a slightly different take on talent.
Yes.
I think that is a concept that people are talented, but not really the case. We all have like similar capabilities, and I suppose it's about nurturing all of our students. And I think the means in which you propose to do so are valid, but I'd be very kind of wary about using talent as a general term. Yeah, I don't know what you think about that, Jalal, yourself.
Yes, sure. I totally agree, actually. Is there anyone of the panelists who would like to ask or answer or discuss?
Dr. Murtada, please.
Yes, Dr. Jamal.
Yeah. Really, I am understanding that they recognize the student talent is not necessarily the talent medicine or in knowledge.
Yeah.
Really, we recognize our students in our college that they have a lot of talents like painting, writing, even singing and music. So one time, really at Eid, we did a party at the night. We spent 2 to 3 hours, and they are spent very nice time to show their talent in music, and we break the ice of e-learning compact time. So we try to refresh them by doing this party, and we promise them to do it every time and another after having a vacation, like Eid, 1 week Eid vacation. We do that. So regarding the knowledge talents, of course, we are open the Google Meet with them, and we let them speak with their colleagues, and they share their idea freely, and we let a lot of time for them to discuss the things, to show themselves and express their idea.
Yes, Dr. Jawad, that's absolutely correct.
I am glad that we have one Mahdi Ahmed. He is asking Dr. Muhammad.
Yes.
Which we can answer Dr. Muhammad. He is the second. Mahdi is his second stage in our college, and then we have another question from Muhammad Basim. Again, he's third stage, and Muhammad Majid is second stage, and Ali Mu'aim in the second stage. Muhammad, if you can answer.
Yeah.
Mahdi.
Yeah, with regard to Mahdi's Ahmed question about how can the student combine and synchronize between his actual education and research, we have to remember we would like the student to get involved in research, not for the purpose of getting the results, but to get into the research culture. So first of all, the research project shouldn't be intensive to disrupt the student from his actual lectures and education. The second point is we can't let them do a big projects like clinical trials. We could get them involved in doing a questionnaire, doing a literature review, systematic review, doing a case report for publication, and to do a bigger sort of a project like a lab-based. This has to come from a higher level at the dean or the management, the higher up, whether they decide to have a block for the 3rd year or 4th year medical students to have a research project. So they will be given enough time to do this, not just the time, but the resources as well, like labs and some other resources.
Yeah, Dr. Muhammad, I totally agree, actually. Thanks for the nice comment. Anybody else would like to add anything?
Dr. Murtada, please.
Yes.
Please, if anyone wants a certificate of attendance, please go to the chat and they find my email and send me an email, and then I will send the certificate.
Yes, that's good, Dr. Hussein. Thanks very much for letting us know.
Dr. Murtada, Muhammad Majid is saying, in your opinion, do you think that answering questions after your study will help you to remembering the information? I mean, more effective than just studying?
Yes, absolutely, yes. So it is a matter of, it is not, I mean, we don't only need to have answers and questions only for the exam. For the whole life, if we have questions and answers, we reflect on ourselves, we strengthen our knowledge, and this is the best way of learning.
notifications or a calendar to set up their own time. Otherwise, they get lost.
Yes, Dr. Mohammed. Thanks very much.
Yes.
Pleasure actually to all of you to be here, and we are honored actually. And I think.
Assalamu alaikum, Dr. Jawad. Assalamu alaikum, Khawari. Hi, everybody.
Hello, everyone.
Thank you very much.
Hello, Dr. Saad. Welcome.
You're welcome, Ustad Aziz.
Okay. So, is there anyone who would like to ask? Or I think we have reached to the end of our webinar today. I would leave any final comments or questions. If there is any questions for our audience or attendees, please forward them to me, and I'm happy to forward them to our panelists. And you are very welcome anytime. And if there is anyone here who would like to say final statements before we end the session.
Dr. Murtada, I just have one question to my senior colleagues in Iraq.
Yeah.
Did we actually run a survey or a feedback from the students, or what sort of problems they are facing with e-learning? Have we listened to them? This is really important. I mean, some of the issues we know them already, but it would be sort of nice to get them involved in the way of learning as well.
Yes.
So
yes, Dr. Ali, every week we did a survey with our students every week about every difficulty.
This question?
The most difficulties with them about
really
the net.
About
the internet connection.
Yes, this is the most important difficulties with them. Otherwise, now about 2 months ago, they all students, our students, engaged in the e-learning, and they are happy. But the difficulty is only in connection with net. This is the difficulty. Yes. And also, Dr. Jawad can answer something.
May I add after Dr. Mazen? At least now, from the beginning.
A gentle reminder from Dr. Hussein for everyone who would like to get a certificate for this webinar. Please pop it in and to send it to Dr. Hussein, and his email is on the chat box.
Dr. Mazen, Assalamu alaikum, Dr. Mazen.
Hi.
Assalamu alaikum.
Assalamu alaikum. Our Chancellor, Dr. Saad Shaheen of the University of Basra.
Welcome, Dr. Saad.
Hi, everybody. Thank you a lot for this nice meeting. I come late because of I have some meeting with the other groups of electronic teaching, which is bombarding our university nowadays because of these facilities. I have one comment on this electronic or e-learning in our university. As you know, this is a new thing for learning of our teachers and students. We are not practicing this thing before, and I think this is something global. It is for every country. This is not the exact teaching which we use. What is noticed from different parts or different colleges in our situation, that we are in need for separation between the two. Actually, we are not going to continue with this teaching alone, or we are not going to continue with the traditional teaching, that is the physically actual attendance of the students and the teachers in the same hall. We are, especially in medical colleges, we are planning to do either the blending type of teaching, that is the combination of the actual teaching and the e-learning, because we are in need for that, especially with the type of teaching which we are using in Al-Zahra Medical College. which is the integrated teaching. We are in need for this blended type of learning, or we are actually used to separate two colleges, one actual college or physically attending college, and the other one is learning from a distance or online learning or e-learning, whatever name you can give it in different parts of the world. So this will give us more acceptance for the students, either to be this or that first, and the same thing for the teachers to be either in this type of learning or that, so that we will prepare ourselves in the future for the learning in the next year, inshallah, if this pandemic of COVID ended peacefully for all of the world. It is something not to be decided now, because we are under the pressure of all the pressures of economy, the pressures of the disease, the pressure of ending the year successfully without losing too much from the passing the students without any assessment, or losing the year totally to the students. So a lot of pressures on us to pass this year with the least losses. While in the next year, when everything is settled, we will think in a different way. We are not under the pressure. So we think, and we are planning, and we are discussing to separate the two things from each other, the electronic learning and the physical learning, or to use the blended learning in order to compensate for the deficiency of cases, patients, attendance of the students in the college. And this is for discussion later on, and we want your experience from that. Thank you very much for your hearing.
Thanks, Dr.
Thank
Saad.
you,
That's
Professor.
actually... Dr. Mazen, yes, please.
Thank you. Thank you, Professor Saad, for your opinion and your knowledge. And we hope we solve all the problem in the future and in the next year between us, and I think we can solve the problem when we take opinion of other countries about the e-learning and how to succeed in e-learning and their opinion in solving some problem. And thank you.
Inshallah. Thank you very
much. Dr. Murtada?
Yes, thanks very much, Dr. Mazen. It's our pleasure to have you today. And I think we have reached the end of our webinar. And Dr. Hussein. Thanks, everyone, and have a good evening. See you later.
Okay. Thank you very much.
Thank you.
Bye-bye.
Thank you. Goodbye.
Bye.
Thank you.
Thank you very much to all the speakers.
Dr. Murtada, please just let 5 minutes of the link.
Okay, I'll leave 5 minutes as Dr. Hussein.
Okay. Ciao, Murtada.
Thanks, you, Andrea.
Thank you. Bye-bye.
Bye-bye.
Thank you. Stay safe, guys.
Thank you.
Yeah, they can forward them to me, and I am happy to pass them to our panelists.
Yeah. Yes.
شكرا جزيلا دكتور مرتضى يعني على التعب وجهودك في هالمؤتمر، يعني شكرا لك.